We are the oncology dietitians at UNC Rex Cancer Care. Today, we will demonstrate how to bolus feed into a G or PEG feeding tube. Feeding tubes are often placed before starting treatment to help meet your nutrition needs and prevent unwanted weight loss. One of the tubes typically placed is called a PEG tube or a G tube. You may have a tube fitted with a legacy tip or an ENFit tip. Both tubes are used to feed food and fluids directly into your stomach. The G tube has 3 labeled ports for feeding, medications, and the balloon. The port labeled feed is the one we will use to provide water and formula. The inflated balloon is the part inside your stomach that prevents the tube from falling out. Some tubes will come with a clamp to use during flushing and feeding to prevent leaking. If yours did not come with a clamp, you can add one or pinch the tube as needed. The external retention bumper sits on the skin and helps keep the tube in place. You may also have stitches and fasteners to prevent movement while the site heals after placement. These should fall off in about 2 weeks. If they do not fall off on their own, reach out to your surgeon or provider for removal. Make a note of what number the bumper is at the day of your tube placement so that you know if it moves. First, we will demonstrate how to flush the tube with water. Even if you are not using the tube for nutrition, it still needs to be flushed daily to keep the tube clean and prevent clogs. Begin using the tube 24 hours after it is placed, unless directed otherwise by your doctor. If you are eating well by mouth, plan to flush the tube daily with 30 milliliters of drinking water or as directed by your dietitian. If you are using tube feeding formula, flush the tube with water before and after each feeding. To meet your fluid needs, it may be necessary to provide additional water flushes between feedings. Your dietitian will help you determine how much water to use and how often. If you are not currently followed by a dietitian, ask your healthcare provider to place a nutrition referral. For flushing your tube, you will need a syringe and room temperature drinking water. Bottled or tap water is fine as long as it is safe to drink. After washing or sanitizing your hands, fill the syringe with 30 milliliters of water. Sit upright and clamp or pinch your feeding tube at the top. This is important to prevent leaking. Then open the stopper at the top of the feeding tube and twist the syringe into place. Open the clamp and slowly press the plunger down. Close the clamp once the water has flowed in. Remove the syringe, then close the stopper on top of the feeding tube. Secure the feeding tube with split gauze and spandage.
Feeding through the tube is similar to flushing it. Expect the tube feeding formula to flow slower as it is thicker than water. To keep the tube clean, you will need to flush it with water before and after the formula. The amount of formula you need will depend on your specific nutrition needs and whether or not you are still eating by mouth. Your dietitian will be able to determine how much tube feeding formula you need each day.
For feeding through the tube, you will need room temperature tube feeding formula, room temperature drinking water, and a syringe. After washing or sanitizing your hands, remove the plunger from the syringe. You can also choose to keep the plunger in if you prefer pushing the formula into the tube, similar to how we demonstrated the water flushes. This method is faster, but it may cause abdominal distress like bloating, gas, or diarrhea. Sit upright and clamp or pinch the feeding tube at the top. Open the stopper at the top of the feeding tube and twist the syringe into place. Fill the syringe with the recommended amount of water. Release the clamp to flush the tube with water. Pour in the tube feeding formula immediately following the water flush. Try not to let the syringe completely empty of formula, as this will cause air to enter your stomach. As the tube feeding formula nears the bottom of the syringe, add additional tube feeding formula. Flush your feeding tube with an additional syringe of water and after you have finished providing all the recommended formula. Once the water has flowed in, the tube should be clean and free of formula. If needed, you can perform additional water flushes to clean the tube. Close the clamp once the water has flowed in. Remove the syringe, then close the stopper on top of the feeding tube. Secure the feeding tube with split gauze or spandage. Place any unused tube feeding formula in the refrigerator for up to 24 hours. Discard after 24 hours. Allow unused tube feeding formula to return to room temperature before feedings, which takes about 30 minutes. However, do not let formula sit at room temperature for more than 4 hours.
To prevent discomfort, sit upright during feedings. Use room temperature fluids and feed slowly. Each feeding should take about 15 minutes. If the tube clogs, gently massage the tube with your fingers from the insertion site out. Flush with 10 milliliters of warm water. If needed, use a back and forth motion with the plunger to help dislodge the clog. If this does not work, close the tube and try again in 15 minutes. If the tube remains clogged, contact your healthcare provider. Thank you for watching this video. Please contact your dietitian if you have any questions.